shoes and out the door. 5, I'm alive. 6, 7, 8, feeling great.
Hello and welcome back to Beyond Your Wildest Genes podcast. My name is Dr. Noah DeCoyer and I'm your co-host. Today our guest is Dr. Barry Raphael. Dr. Barry Raphael has been in the private practice of orthodontics since 1983, carrying on a family tradition since 1950. Over that time, his interest in early treatment has led to the incorporation of techniques designed to prevent malocclusion and airway-related oral dysfunctions, AROD, like sleep-disordered breathing and oral habits that affect facial growth. Dr. Raphael teaches these techniques on the graduate and postgraduate level. He is founder of the new Raphael Center for Integrative Education, whose mission is to teach patients, parents, and professionals about ARODs and treatment alternatives. Hello, Dr. Raphael. How are you doing today?
Hello, Noah. Thanks for having me on.
Full disclosure, Dr. Raphael is a part of my family's personal health care team, and I'm thrilled to have you on our podcast today.
Yeah, I'm thrilled to be working with your boys. They're terrific.
And me too. Don't forget about me.
Yeah, and you too.
All right. So listen, let's get right into it. When I was a kid, I had braces like nearly all my friends did. And when I grew up, my dentist told me that crooked teeth are inherited from your parents, and it's almost impossible to avoid. Now there's some people questioning that, and you're one of them. What do you know, and what are your thoughts on that?
Yeah, well, listen, when I was taught in orthodontic school, I was taught the same thing. And for the first 25 years of my career, I was telling people that when I was asked why they had crooked teeth, I was telling them that they got their parents' teeth, the mother's teeth and the father's jaw, or the father's upper jaw and the mother's lower jaw. But there's quite a bit of evidence that there's really there are no genes for crooked teeth. There are no genes that tell a tooth what position to come in. That as teeth are erupting, from the very earliest stages, the genetics just isn't precise enough to tell a tooth exactly where to come in. Teeth erupt and they come in following a path of least resistance, and they're guided into place by all the muscles of the mouth and all the actions of the mouth that surround them. So, for instance, if the tongue is up on the roof of the mouth, that will help guide the upper teeth in place. If the cheeks and the lips are on the outside of the teeth, they will help guide the teeth in place. And we used to think for a while that it was chewing and swallowing and speaking that were big influences, but to tell you the truth, the biggest influence of all is the way we hold our mouths at rest. That is, when we're not doing any of those functions, and especially the way that we sleep at night, the way we hold our mouth significantly determines just how the teeth are going to come in. If the tongue is on the roof of the mouth, it serves as a terrific guide for the teeth. And the teeth actually surround the tongue, and the upper jaw bone grows around the tongue as well. In other words, the tongue is kind of a scaffold over which the upper jaw and the teeth erupt. When, for instance, a child cannot breathe through their nose well, or even just out of habit, if they let their mouths hang open, the tongue is not up on the roof of the mouth. And this can be for hours and hours a day, including, the hours of sleep. And then the upper jaw and the teeth come in a very different way. Usually the upper jaw tends not to fill out the way it's supposed to. And then when the teeth have to come in, they've got to squash their way in one way or another. You find that each tooth that doesn't have quite enough space will figure out a way to come in towards the front or the back. It'll turn halfway around and slide into place. Well, this probably explains about 80% of the crooked teeth that I see.
So when we look at the position of your tongue, explain that just a little bit more for our listeners, because that is at a subconscious level. Most of us have our tongues on the roofs of our mouth, but we don't even realize it.
Yeah, well, actually, I would argue that point in that our bodies tend to be compensating for a number of very general stressors that have changed our current environment drastically. In the past, say, 500 years since we started eating sugar, especially in the last 150 years during the Industrial Revolution, we're all well aware of the fact that our environment is flooded with elements that our bodies never had to deal with before. And so there are a number of metabolic challenges that we're facing, and they all kind of lead up to our bodies compensating by letting the mouths hang open and breathing more through our mouths than we ever have before. The human animal is supposed to be a nasal breather. And certainly when we're born, we're breathing through our nose. We wouldn't be able to nurse properly if we had to breathe through our mouth while we were suckling. But something happens along the way, and we're really thinking that this transfer from nasal breathing to oral breathing is endemic in the population.
Really?
Yep. For many, it can be an acute problem. That is, say you get a cold or you have nasal congestion, stuffed sinuses, maybe allergies, earaches, or asthma or asthma symptoms. Many things will cause us to have trouble breathing through our nose acutely. If we take care of it, that's fine. But too often, these things lead into protracted and then chronic habits. And it's these chronic habits that really lead to the problems that are causing crooked teeth. So many of us think that this open mouth posture or low tongue posture is endemic in our society right now. And hence the incidence of crooked teeth has dramatically increased over the last centuries, despite the efforts of the orthodontic profession.
That's incredibly interesting. Now,
Yep.
one of the first conversations we had when I first met you was regarding Weston Price, a dentist, and you talked a little bit about some cultural differences and stressors and the introduction of sugars and a change in diet. Well, fill our audience in a little bit on who Weston Price was, what he contributed to what you're doing, and how important his work was.
Well, Weston Price was actually one of probably a dozen investigators over the past 100 or even 150 years that had noticed that indigenous populations that were eating ancestral diets, that is, diets that their lineage had been eating for hundreds of years, and all over the world this was demonstrated, that when they were eating ancestral diets, that they had big, broad arches with room for 32 teeth to come in perfectly straight. And the anthropologists are verifying that for us, that the human animal has been designed to have 32 straight teeth. And up until relatively recently, that has been the case. When you look at ancient skulls, you can find crooked teeth in maybe less than 5% of them, and even that is, relatively mild. What Weston Price and many others saw was that when these indigenous populations were exposed to the modern diet, which basically would be sugar of any sort, processed foods, processed, short or long chain carbohydrates, which easily become sugar in the body, and processed foods that didn't really require much chewing. That's when, within one or even two generations, the children would start to exhibit crooked teeth and caries, dental decay, by the way. And this phenomenon has been recognized all over the world. So Weston Price, as a dentist from Ohio, had this hobby of traveling all over the world and documented this phenomenon. He would show people with ancestral diets, large mouths, 32 teeth, by the way, Noah, means that there's room for your wisdom teeth.
Right. They don't have to be removed, right?
That's exactly right. Now, when I poll people, mostly 80% of people say they've had to have their wisdom teeth removed. And that's not a problem of the wisdom teeth. That's a problem of the container. That is, the jaw bones have never really filled out the way they're supposed to. And those last teeth are the ones that get gypped out of space. So this Price demonstrated this in his book. I'm sorry, the name's kind of skipping my name.
Something in physical degeneration, right?
Degeneration, right? And I should know the book. I mean, I use it all the time, right? That there's pictures galore from northern latitudes, from southern latitudes, from third world countries, from developed countries that still had indigenous populations. There are actually a very few of them still today, some Polynesian islands and so forth, where the industrial diet hasn't quite reached. And then he shows the pictures of these people or their children, one generation later, where the teeth start to collapse. And this is the scariest part of this, there's an epigenetic phenomenon where these traits start getting passed down through the generations, where it gets worse and worse with every generation. And now we're seeing in our population, crooked teeth really are becoming, endemic or epidemic. I have parents telling me all the time, "Oh yeah, everybody gets braces now." Well, yeah, everybody does, because we're already into the third, fourth, fifth generation of the Industrial Revolution, and it's taking a toll on our faces. Now,
when I first heard about Weston Price, it absolutely astounded me, and
Yeah.
it fascinated me as well. I mean, what it told me was that, as you said right from the beginning, that crooked teeth are not a result of your genes. It's a result of an epigenetic factor. Epigenetic meaning above the genes. Epigenetic meaning an environmental factor that affected the structure of your jaw, of your teeth, like you said, not being able to carry 32 teeth, and the simple
Right.
fact of moving away from a diet that best suited how you're supposed to eat. The effect was crooked teeth, and who knows what other effects, but those were the most obvious and most easily categorized.
Yeah, well, we do know what other effects. I mean, I'm sure you've dealt with this on your podcast before. Our species is suffering from a whole host of chronic, non-communicable diseases of civilization, which include things like heart disease and fatty liver disease, obesity, diabetes, especially what used to be called adult onset. Now type 2s can start early in life. So can obesity. The list goes on of all these chronic problems that medicine is treating symptomatically, but is doing nothing to solve. Now we have a growing awareness that there are these environmental factors that can be mitigated. And in fact, my orthodontic practice is now aimed at mitigating some of these things. The Weston Price book, by the way, is called Nutrition and Physical Degeneration.
Yeah, that's exactly it. It's a book that everybody can own and have for sure.
Yeah, there's an organization that supports the teachings and the writings of Weston Price that has actually gone way beyond what they are doing now. You can find them at westonprice.org.
Yeah, it's the Price Pottinger Foundation, right?
Right, exactly.
Right. Now, you mentioned it too about breastfeeding and suckling. Is the moving away from breastfeeding creating more of an issue or compounding this problem that we're speaking about now?
Right. Yes, and there are several things about our modern world that that are changing the way our faces are growing. And frankly, while we used to just throw our hands up and say, oh, right, well, you'll need braces at braces age, we now have an incredible opportunity to intercept and mitigate some of these problems. So they do start from birth. There are certainly issues about prenatal care that can influence the way the face takes shape, even in utero. The birthing process, which has changed quite a bit from natural times, where we have social compensations that are supposed to make things easier for us, but that have their side effects. So bottle feeding, for instance, is a social compensation. It really took hold when women started to go to work at the beginning of the or go to work outside the home during the beginning of the Industrial Revolution. There's still an attitude about breastfeeding that among many women that it's not a desirable thing to do. Of course, we're seeing a big change in that, fortunately. The action of breastfeeding to the growing face is important, not just because of its nutritional benefits and the way it confers immunity from the mother and so forth, but the actual action of suckling off a mom's breast exercises the muscles and the tongue in a way that helps the bones develop. Once you get past nursing, a social compensation of baby food, which would be pre-processed, pre-chewed, food that was easy to feed, that also has its side effects because, again, the muscles are not being used in the way they were designed to be used, and of course the content of formula and baby food contains many of the new nutritional elements, many of which are made of petroleum. And our bodies were never meant to eat petroleum, and yet they are often the key elements in things like pesticides and fertilizers and preservatives and food colorings and antibiotics that we so often find in our food source now. So what else? The way we breathe, of course, I mentioned that earlier, but it really stands to be emphasized that in our struggle against many of these environmental elements, we're having difficulty breathing, and we find kids having bad breathing habits even as infants. There was a study out just a couple years ago that really kind of rocked my world that showed that infants that are snoring, even if the time that they were snoring only lasted for a few months and then went away as the airway grew and all, that those snoring children would have difficulties with things like cognition and attention by the time they were in first grade. It kind of highlights the fact that the developing brain is extremely sensitive to its oxygen supply, as we might imagine, and that breathing issues that are occurring chronically with children are going to have an effect on the way the brain grows. All of a sudden, these early life issues become very important in setting the trajectory not only for physical health but for mental health for children.
Yes, so let me say that in a different way and see if you agree. So open mouth posture, poor tongue posture, poor sleeping habits as a result of that could be the result or one of the causes for the increase in attention deficit that we're seeing in our children today.
Yes, absolutely. There's a fairly well-known pediatric sleep physician in Chicago, Stephen Sheldon, who's come out to say that perhaps 70 or 80% of what we are now medicating as attention deficit or attention hyperactivity disorder, is related to sleep. That these kids are just not getting a solid night's sleep. And, what we're doing here in orthodontics is we're kind of connecting the dots backward from those issues, saying that if the kids can't sleep well, they have problems. If they can't breathe well at night, then they're not going to be able to sleep well. If their faces don't fill out, if the jaw bones don't fill out, the airway is, as a result, somewhat smaller and constricted behind the hard palate and the tongue, and the airway smaller, and they can't breathe well. In fact, a recent study of SIDS babies showed that they all had one thing in common. That was some daytime breathing problems and small and narrow jaws. So this really becomes a huge issue that's affecting many parts of children's lives. And frankly, I find my motivation to be doing this early treatment work more about the overall well-being of the child than simply just straight teeth.
No, it's exactly why when I introduced you, I said you're part of my health and wellness team. I did not call you one of my dentists.
Yeah, that's right. I really feel that even though it hasn't happened on a large scale yet, that orthodontics really needs to refurbish its position as part of the medical care of a child, not just the aesthetic care of a child.
So we've really outlined the problem. What are the causes? What have been the causes of growing over the last several hundred years? But the beauty is you're trained in mitigating and correcting these issues. So talk about what you can do and what others are doing around the country to fix this issue.
Well, there's things that you can do along a timeline through life, where with the infant there are issues that you can, there are actions that you can take to help reduce the incidence of this problem. By establishing good habits early on, there are a lot of things that we can do to mitigate the problem all along the timeline of a person's life. Certainly for the infant, there are many preventive measures that we could take. Natural feeding, baby-led weaning onto foods that require chewing, especially ensuring good nasal breathing from the beginning. I think parents need to be made aware that an open mouth posture will eventually be detrimental. And then any of the social compensations that are used for the baby that encourage a low tongue posture have to be used judiciously. I'm talking about baby bottles and pacifiers and allowing thumb habits and so forth. These tend over the long run to lead to problems. And then check with what I'm calling an airway conscious dentist or orthodontist about how the upper jaw is growing. So, for instance, with kids with baby teeth, one overlooked issue is that when the baby teeth appear straight but are without spaces between them, that's an indicator that the jaw is not forming properly. That baby teeth are supposed to be well spaced because those little baby teeth are going to be succeeded by much larger permanent teeth. Now, once you get to toddlers and the baby teeth are starting to fall out and the new teeth are beginning to come in, we still want to establish the same good habits, but we also want to undo whatever damage has been caused by the early habits in the first place. There are also a number of things that we can do for the child who's losing their baby teeth and starting to grow their permanent teeth. We not only have to establish good habits including nasal breathing and closed lip posture and tongue to the palate, and a transition from the infantile swallow, which uses facial muscles, the lips and cheeks and so forth, to a mature swallow that uses just the tongue to swallow and not the lips and cheeks and so forth. We also have to undo some of the damage that may have been done by bad habits in the first place. So this is where the orthodontist really has a set of skills that can be used to help reform the jaws back to where they're supposed to be. Unfortunately, right now, there's quite a bit of argument in the orthodontic community about when to do this kind of work. Most orthodontists will tend to wait till a later age because they're focused mostly on the teeth. But by the time you're ready for braces age, then the jaw bones have already pretty much taken their size and shape, and there's a lot less you can do to mitigate it. So airway fluent, airway conscious orthodontics has to be focused on the growth of the jaws, not so much the position of the teeth. Once you get to the age where the jaws have been set and the teeth are in, there's a lot, of course, that could be done for the teeth, but not so much the ability to affect the size and shape of the jaw bones. Now, when you get past braces age, this is where you start to see some of the long-term effects of improper jaw growth. And that when people are growing up with airways that have not quite filled out, that they start suffering from sleep problems because it becomes harder to breathe through what is essentially a much narrower breathing tube than they would if the jaws filled out properly. And so not only are we seeing a higher incidence of crooked teeth, we're also starting to see a higher incidence of sleep and breathing disorders, including sleep apnea. Now, sleep apnea is a topic that we could cover as well. And we know that there are a number of social dangers to this because some of the worst accidents of the past decades have been now attributed to sleep apnea, including running ships into shorelines, trains off of tracks, trucks into buses, and on and on. There's been a lot of attention paid to loss of productivity because of daytime sleepiness, which is really a product of this inability to breathe well at night.
So when I first started practice as a chiropractor about 15 years ago, the only people that had sleep apnea were the really large, overweight people in my practice. Now it's anybody can have sleep apnea, and it's changed just in the last few years, at least from what I've seen.
Yeah. Well, we know that the shape of the face is a primary risk factor for sleep disordered breathing. So if you can imagine this, you've got the upper jaw, which carries the upper teeth. It has the soft palate hanging off the back of it. You have the lower jaw, which carries the lower teeth, the tongue in the front, and also the tongue goes way to the back of the mouth. So the front wall of the breathing space, once it gets past your nose, is the soft palate and the tongue. And when both of them are set back in the face because the jaws have not grown forward the way they're supposed to, that breathing space is necessarily smaller. The smaller it is, the easier it is to close off when you lay down, go to sleep, have your muscles relax, and so forth. Certainly getting older and fatter and flabbier makes the situation worse. And we know that the problem of obesity is really tied into the same phenomenon of modern compensations. But nonetheless, there are plenty of people that have small airways that are not heavy, and even some skinny women, some very athletic, can have very small airways. Now, apnea is actually an end-stage disease. That is, it occurs when the airway actually closes off. And of course, the way medicine is treating this is as a bona fide problem for which there is their own compensation, which is CPAP, right? So you take a hose to the nose and blow air through it, and it holds the airway open. And this is about all that modern medicine has to offer. But what's so far gone fairly unrecognized is the fact that there's a huge lead up to sleep apnea, where a person's musculature doesn't just collapse, but the brain has to stay ever active all night long to prevent that collapse. That means that just to keep yourself breathing properly, that the brain has to stay alert, vigilant all night long to make sure that the muscles don't relax. And this leads to another realm of sleep disordered breathing, which we're now calling upper airway resistance syndrome. And that is the body never can get to the deeper levels of sleep because it's always on guard. And I think as we learn more about sleep, and of course we're learning more about its importance too, we're going to see that there is as big an incidence of upper airway resistance as there is of crooked teeth. For the two really go together, they are both linked to the same phenomenon.
It's amazing. And in some ways that's what we're doing. If I could use myself as an example, I mean we're testing out some different appliances on me to bring my lower jaw a little bit forward to even increase my airway more. Correct?
Right. That's exactly right. For people that, for instance, can't tolerate CPAP. And it's well known that there's probably a bigger market on eBay for unused CPAP machines than there is for the new machines, because so many people can't stand them or tolerate them. There is another avenue that's being explored in dentistry, and that is use appliances that force you to hold your lower jaw forward, which basically brings the tongue out from the back of the mouth and thereby opening up the airway.
I'm sorry to interrupt.
Sure.
You even have the equipment, and I'm sure other people in the country do, sophisticated X-ray to see if the person's how wide or open the person's airway is. Correct?
Oh yeah, with the new 3D imaging technology, we can look at the size and shape of the airway from the tip of the nose all the way to the epiglottis. And the ability to actually measure the volume of the airway has been very helpful for us. Of course, that's only one of several factors in how well the airway works. We could talk about that in a minute. But these dental appliances that pull the lower jaw forward are actually mimicking the kind of orthodontic work that we're doing for kids when we try to reverse the damage that's been done. One of the things that we're doing orthodontically when I focus on the jaws is first to help the upper jaw regain its shape in 3 dimensions of space. When I see crooked teeth in the upper arch, I'm almost certain that the upper jaw has collapsed both in width and depth and is somewhat excessive in height, which it would be kind of nice to show a 3-dimensional model of a before and after here where you can literally see in the shape of someone's face how that upper jaw has taken shape. Once we get the upper jaw back into place, then we help the lower jaw grow forward to meet that new position. For the lower jaw is often recessed because of the collapsed upper jaw. In fact, there are a number of orthodontic techniques whose end goal is to get the jaws to grow forward as much as possible, thereby opening up the airway.
Absolutely fascinating. So let me then summarize or put into words some of the goals of your therapy. You want to create nasal breathing. You want to have lips together, tongue on the top of the palate, quiet swallowing, and a lower jaw forward. Is that correct?
Yeah, that's a great summary. If I get those four elements, the nasal breathing, lip closure, tongue on the palate, quiet swallow, in other words, not using the lips or cheeks or chin to swallow, then I know I've reestablished the impetus for proper growth in the child. And if that's done early enough, then we can get good growth. In fact, I can help children grow up with straight teeth and not need braces at all.
Can you repeat that again?
Yeah. I certainly am hoping that we'll see that for your sons, that we're establishing good habits, good posture, and all the conditions necessary for the human animal to grow up with enough room for 32 teeth, coming straight. If I can start early enough, I can do that. I don't always get to see kids early enough to be able to do that, and so my next goal, once I establish those four habits, is to be able to do orthodontics more easily, more successfully, and frankly, without without having to take out permanent teeth as part of the treatment plan. I'm sure your listeners are aware, many of them may have had to go through this experience because it was done for a long time, in fact, still being done, that when the teeth are crowded, many orthodontists blame the teeth and literally kick out four members, one in each corner of the mouth, to make room for the rest, as if it's the teeth that's the problem. Once you get the jaws to grow properly, that technique almost never has to be used.
So your takeaway message then, and I think you might have already stated it, but give us a great summary.
Well, the first thing to realize is that our society is dealing with a huge issue in medicine, in that while we have become very good at taking care of symptoms, that we are often not really dealing with the causes of the problems. And orthodontics is no exception to this. Straightening teeth with braces alone is just a symptomatic treatment. And while it may be predictable and fairly successful, at least on the surface, it ignores all the muscular and breathing imbalances that caused the problem in the first place. And frankly, there are going to be issues that are the result of that. That if we can deal with the habits that create the problem early on, then we have a much better chance of reestablishing the balance, not just of the teeth, but of the breathing mechanism and posture and so forth. In our office, we like to say we not only take care of the teeth attached to the child, but we take care of the child attached to the teeth as well. And that's where your work, Noah, and mine can intersect. In fact, a multidisciplinary approach to crooked teeth really has become the way that I practice now.
And that's my next question, and you could speak about this. And you could speak about your new institute. If someone wanted to get in touch with you, Dr. Barry, and they lived in this North Jersey, New York City area, how could they get a hold of you?
Well, I didn't know you were going to have me do a commercial.
Why not? Why not?
All right. Well, I certainly hope that I am part of the solution and not part of the problem. And the people that are near me can find me at alignmind.com, alignmine.com. That name is actually a holdover from when I was really concerned with the alignment of the teeth. I keep it simply because it has such a strength on Google search that I'm afraid to get rid of it. But I also suggest that people talk to their dentists and their orthodontists about learning about airway issues and how their work can be influenced, how their work influences their own dental health and their children's dental health. Because one of my missions is not only to treat patients, but to alert other practitioners to the importance of this issue.
Great, great. Now, we truly appreciate the time you have given us today, Dr. Barry, and I personally thank you for taking care of me and my family.
Well, you're very welcome, and in both ways. I'm very happy to do it.
Any last words?
Well, watch your children's mouths. Look for open mouth posture. It's probably the single most important piece of advice I could give.
Great. Thank you. My name is Dr. Noah DeCoyer, your co-host, and you are listening to the Beyond Your Wildest Genes podcast. If you like what you've heard today, please share this with your friends and family. Encourage them to subscribe on iTunes. You can sign up for our incredible weekly email at www.centerforepigeneticexpression.com. And please let me encourage you to check out our first project/summit at www.painreliefproject.com. Thank you, and as my oldest son Hayden says, be awesome and never unawesome.